Good afternoon, and welcome to the Rockefeller Institute's webinar on public sector management following the COVID-19 public health emergency. Before we begin, I want to thank you and our distinguished panelists, Albany County Executive Dan McCoy, Barbara Gwen, Jeremy Goldberg, and Madri Kamaretti for joining us. I'm Joe Popkin, Director of Policy and Practice at the Institute and moderator of today's discussion. We will begin with brief presentations from our panelists, then a facilitated question and answer session at the end. Please submit your questions through the Q&A function of the webinar. The topic of our conversation has been 6 months in the making and will continue to be a part of our daily lives for the foreseeable future. But with this moment in time to reflect, we want to learn and share how state and local governments in New York responded to and have begun to recover from the pandemic, and specifically how public sector management has changed. Next slide. Day 194, as the governor would say. As the pandemic began in early March here in New York, state and local governments rapidly adopted new policies and adapted their operations to support a state and local workforce that is both able to work more remotely and to deliver essential services to constituents virtually. These policy and operation changes, along with many others, have dramatically altered the landscape of the public sector. At a time when the demand for effective government has never been more apparent, it is critical for public sector managers and the public writ large to understand this dynamic landscape in order to reimagine it, ensuring stability and productivity within our workforce, as well as attracting and retaining the people who make government work at the end of the day. Today, we will hear from executives in state and local agencies who have developed new management approaches, leveraged telecommuting options, deployed public health and safety precautions for in-person work, and identified key opportunities to improve resiliency and ensure continuity of their operations during this new normal. Next slide, please. As Governor Cuomo wrote, it's time to rethink our most basic assumptions about the role of government. It's a chance to address both surface and systemic problems. It's an opportunity to not just build back, but build back better, smarter, tougher, more resilient, and more equal. Next slide, please. With that in mind, it is my pleasure to introduce Albany County Executive Dan McCoy. County Executive McCoy is currently serving his third term as Albany County Executive. Before being elected as County Executive in 2011, Executive McCoy served 12 years as a county legislator. He was unanimously elected by his peers to be chairman of the legislature and served in that capacity for 2 years. He also served for 3 years as chairman of the Albany County Democratic Committee. For his steadfast leadership, County Executive McCoy was named County Leader of the Year in November 2017 by American City and County magazine. In May 2018, he received the Mary Goldberg Distinguished Service Award from the Association of the United States Army First Region. Dan also serves as president of the County Executives of America, as well as the County Executive Association of the New York State Association of Counties. Thank you for being with us, County Executive.
Thank you, Joe, and I appreciate this opportunity. Good afternoon, everyone. The world around us has changed. You either had to change with it or you fell behind. And the way we operated 6 months ago, as you eloquently said, as the governor said 194 days ago, has changed. Still a little bit from the governor. We had to be resilient. We had to change the cohesiveness of the organization, which was tough because, you know, in government, you're used to doing things a certain way. And when the world changes, we had to change with it. We had to deliver services differently. We had to look at the way we delivered services. And then you got a workforce that never typically worked from home. You know, private sector jobs are more adapted to changing to that environment, working from their house compared to government. It turns into a logistical nightmare. But when we got hit with this day one, the first thing I did, and probably falls back on my military training, I divided my core staff up. I got my deputy away from me, put everyone in 3 different locations, had 3 EOCs going at the same time, and separated because we didn't know how bad this was going to affect us. And then you need leadership. And I do want to thank Governor Cuomo for his leadership. it's easy to be a Monday morning quarterback and argue with the way things are done. When you're getting all this data thrown at you and all this information, and you have to siphon through it and do what's best for the people, it's hard. And we still have an obligation to the people to deliver the quality services that they're used to. And in a lot of cases, reinvent these services, working with agencies that have, a lot of red tape involved because they didn't predict the coronavirus or an epidemic like that we just been faced with. So as we started to move forward and being in the post 9/11 world, 19 years later, we get hit. And one thing I do say, and I think the governor's right about New York being tough, we are very resilient of bouncing back through any crisis that we face. But one of the things I started early on, I go, this isn't just about this year. This is going to be about, 2020, 2021, 2022, because our finances on top of the health crisis are all tanking. And without the relief from the federal government, we're in trouble. And we still have an obligation for the services that go forward. And we went to telecommunications with a lot of stuff, with our health department, mental health patients. It works for some people, but most people want that human contact. Especially with people with mental problems, or even kids that we have to give OT services to, or speech. A lot of things have to be in person, and you have to learn differently. Even though you see kids being pushed down the street in a stroller, at 2 and 3, and they all got electronics in their hand and they're all playing it, it's still different. They can adapt a little bit quicker, but we like that human reaction. We weren't set up initially to have people work at home. That means ordering computers. Our IT department worked around the clock to make this possible. And it wasn't, we're still trying to figure out what you can do at home. And there's a lot of things that have to be done in person that you can't let certain people work at home. We've had less than 46% of the workforce back in our buildings. And then we slowly still have a lot of people at home working remote. And now it's training supervisors, not just the commissioners, the supervisors, to make sure that they're doing the work's getting done effectively. And it's a learning curve for everyone, because I don't know on this panel how many have kids or don't have kids, but being a father of 3, and I remember being home, it's not easy to work because they don't understand mom, dad, or their guardians on the phone doing work or taking care of things. They want their cup of water, or they want to change the TV, or they're fighting over something. You got to break that up and balance it. And that puts more stress on the person that's home. So, you have to factor all that stuff in. But again, we had to learn differently. And part of it, like with probation, we did a lot of stuff online, but it's not the same. We had children, and unfortunately, I don't want to say fell through the cracks, but there's houses we had to visit under court orders to make sure they weren't being neglected, make sure things were happening, but we couldn't do that. You can go on the camera, but like here, it gives you so much of the picture, right? So it's not like you can look in another room, you can see what's going on, you can put the kid to the side. Workers who are trained in that field, they're not trained to look through Zoom or Skype. And that's the other thing, because most people are like they had a hard time adapting to Zoom. They didn't know how to set it up, or Skype. They had a hard time getting on links, and you would spend 15, 20 minutes waiting for everyone to get online to start working or get ahead. So it's been a huge learning curve, but I have to say, the workforce in this state are resilient, and we figured it out, and we're still figuring it out as we go forward, and especially as dollars shrink, and they're gonna shrink. And I said this to a reporter, I think it was a month into it, and he goes, "What's scaring you the most?" I go, 2022. Because I know the ripple effect this was gonna have on. And if you look at the little recession of 08, 09 that we went through, that's like a hiccup in the road compared to what we're going to be going through. And we haven't seen the worst. Yes, we got through this health crisis. It's still there. We're still dealing with it. Most people feel like, well, people aren't in the hospital. They're not in the ICU. We're not losing people at the same rate. The governor wants to keep us locked up. The counties want to keep us locked up. But it's hard to reimagine what the world's going to look like. And that's why I started using that in the beginning, saying when you come out of being home for 4 months, the world's going to be different, and you have to adjust to it. And you have to understand wearing a mask and socially distance and all these things that we taught the kids how to brush their teeth or turn the water off while they're brushing their teeth, little things like that. Even myself, I can't tell you how many times I walk out of my office and I'm like, I forgot my mask again. I forgot my mask. Or you get out of your car and you're like, I won't use that word. You go back and you get your mask and You're like, it happens, right? Because we're not used to it. And as you look around this world, the way it's affecting everyone, and I was following in Italy, I was following the governor's leadership, and as it started to unfold, trying to make workers feel safe coming in. And a lot of our workspace, we're on top of each other. They're in cubicles, certain people are uncomfortable, the phobias kick in. And that's why I set up right away, day 2, a mental health hotline. Because being in the military and when I was serving in Iraq, you know what, you think you can handle everything till you have to deal with it. And people have different stress levels. And that's why I always try to remind everyone, being in politics, my stress level's high. I'm used to being the punching bag, or, oh, he doesn't know what he's doing. So I got a high tolerance, but doesn't mean the person next to me does. Doesn't mean that how many friends do you have don't like going to wakes or don't like seeing a sick person in the hospital because they can't handle it? So you have to look at it from their point of view, and especially the workers. And now trying to train to take county workers or state workers or city workers that never had to work from home, and trying to get that whole atmosphere running is tough. And the fact that schools aren't fully really open. That's another issue that we're dealing with, because we have a lot of daycare issues. Parents got to take care of their kids, but then we still got to get work done, and they still have to come in. So there's been so many things that we've changed and adapted. And there's a lot of areas that, it's been good. I'll say this, you take the pros with the cons, and the pro being learning how much more we can do remotely, but how we can do it smarter, more effective, and less cost. Because when you're not faced with these dilemmas or hurdles, I like to call problems in life hurdles, and they're meant to get over. When you don't really, in government, it's easy just to say raise taxes. We can't do it because this is the way it's set up. I'll pick on the state because I see you over there from the Transportation Disability Assistance. There's red tape, and you have to cut through it, and you have to reimagine what it's looking at. And the telecommunications with medicine has been phenomenal for a lot of people. That's really worked. And then, it hasn't worked out so well trying to kids with disabilities and different things we've dealt with through our different services, trying to do it via Zoom. That didn't work. So there's certain things we have to come in for. Like our finance office, we never shut down. They stayed open. Why? Because we collect money. People were still paying their bills, believe it or not, we're coming down paying their taxes. But you have to look at how do we operate going forward, and some of the things that we're faced with. And one of the things I said this to Dr. Whalen today, no one really knew what a health department did in a county or the state. You don't think of DOH, you don't think of what the health department does, or any agencies. And now people really realize it's like one of them entities that you really don't want to know that's there until something like this happens. And when this rolled out, people know what the health department do now, from the epi, from tracing, and getting involved that way. And one of the other things I saw early on too was mobile testing for people that in neighborhoods that don't have transportation, can't get to testing sites, or didn't have insurance. So we covered all that. We got mobile testing set up in underserved communities to make sure it wasn't affecting them communities like it was on a national level. And then it's working in partnerships. I worked with Schenectady to help them out. Rensselaer, we all were working intertwined with each other, really just kind of like a support network. And it was kind of crazy in the beginning because my day would start at 5:30 in the morning, and I'd go to 1 in the morning, and then I'd talk to county executives that night from our phone cards out in Erie County, and Steve Newhouse down in Orange or Latimer, and just kind of, it's all new. We're all faced with this new dilemma, how we're going to operate to move forward. And, it's hard. Not every, I always say to everyone, I'll say this again, and I beat this up all the time, be part of the solution, not part of the problem. It's easy to go on Facebook or on these sites and beat the hell out of the decisions we make. And I'm like, if you got a better idea, please give it to us. Tell us how we can better serve your children, better serve the services that we're doing. We're open. And I'm not saying every decision I made was the right decision, but you have to make a decision at the end of the day, be it nursing homes or be it the way we're handling probation. You have to adapt to the environment that you're in. So it's really taught us a lot about ourselves. It really showed me a lot about commissioners, and then dealing with this fiscal crisis. It's easy to sit there and go to every one of my commissioners and deputy commissioners, I'm going to lower your salary by 25%. We're going to cut all this to save money. But I'm asking my commissioners and deputy commissioners work harder than they ever had. And they always work hard, don't get me wrong. But now I'm expecting more out of them, and I want to pay them less. And you look at the workforce, and you're like, okay, this has taught me what a workforce can really look like. But there's that ripple effect. You cut people off, you lay people off. There's a variety of things that we're going through. So initially, through all this too, I did a $15,000 buyout for people that want to retire, that just don't want to retire or want to leave. And you'd be surprised. We had a certain goal. We're well over 100 people that put in for it. Most of them can't even retire. Certain people aren't comfortable coming back to the workforce, or they just don't want to work at home. Again, because it's a different world out there. And one of the unique aspects I got was being president of County Executives of America for the last 2 years. My term was up in July, and I got roped into another meeting. They extended my term for 6 months because they're like, "You're doing a good job." I'm like, "No, I want to get more stuff off my plate," because I was dealing at a national level as well as a statewide level, dealing with the county too. But it was good. I got to talk to other governors from around the country. I talked to a lot of executives, what they were doing, and it was a good little think tank. And that's why I want to say to Rockefeller, thank you. We always end up going to Rockefeller for different issues and initiatives that we're doing in the county for that reason. You can't be afraid not to be the smartest person in the room. You just got to surround yourself with talented people, and I like to do that, and I always say that. But you have to work together in a partnership. And, it was kind of unique. I got to do a ribbon cutting, which I really didn't want to go to. I don't like to go out as much as everyone else. But ENT Otda and St. Peter's Hospital did a merger yesterday, and it was in the works 2 years ago. But I go, what better thing to explain or to put out to the public today? Here's a partnership that's going to save money. It's going to give you better services going into the future. And again, it's going to be the quality of care that they're going to give at the new office space that they just opened up. It's like 54,000 square feet. But that's how we have to think going into the future. That means me maybe looking at programs that the city runs and merging our programs or our departments together that can better function, but do it for less and still give that services people are entitled to. So if it's taught me anything, it's that. And then as we look at crisis, one of the things I looked at in 08, 09, when we went through that recession, because I was in the legislature, it took us out to about 2015 to bail ourselves out of that. We were borrowing $15 million to make payroll. We borrowed against our retirement to the tune of like $38 million. We had $20 million in our reserves, and we built all that back up. But I said we have to be ready for a crisis. That I think we're planning for this? Absolutely not. And that's the same thing like with the medical corps that we have. It's all volunteer medical corps that works out of the health department, and it's doctors, nurses, pharmacists, just regular volunteers, EMTs, paramedics, and they train every year for stuff like this. And it did catch a lot of places off guard because of the PPE. That was a big issue for a lot of people, trying to find the mask or hand sanitizer, you name it. It was a big issue. And we tackled it. And then it's hard to say when we plan for the future, what are we planning for? We're still in this. And as we look forward to the next thing, till we get a vaccine, till it gets under control, and the governor's done a great job staying at under 1%. But the other issue is people want to travel, right? And I can't tell you how many people I know that go, "Oh, I'm going to Florida, but I'm going to stay at my parents' house. I'm not going to do anything." I'm like, "Well, then why are you going to Florida? Why don't you just sit in your own backyard?" And then then you got to explain to them, now you got to do the right thing in quarantine. "Well, you pay me now that I got to quarantine." I'm like, "No, we don't. It was your choice to go on vacation. It was your choice not to do the right thing." And it's tough because people want to get out. The one thing I'll say, and I know my time's almost up, the one thing that I take away from this whole thing is people really got to explore New York State. They got back into our park systems. They got back to our trails. And they discovered a whole new area. I just was reading Lake George had a great year because people went there that normally wouldn't go there. They'd be going to Virginia, South Carolina, Myrtle Beach area that stayed local. And this state has so much to offer. And I'm hoping that translates into future years of people saying, "Hey, why drive 15 hours to Myrtle Beach when I can go to Lake George in 2 hours and have just as much fun. But as we continue to work forward, if people aren't realizing things aren't going to go back to a norm, what they thought the norm was, they're not really looking at this and taking a step back. And I'll say this, I say it all the time, this is a marathon, not a sprint. We got to walk our way through this and continue to come up with new ways of operating government and being resilient to change everything that we're doing, not just here in government, but operating as a whole in the public sector. And some of the issues that we have is you're going to see a lot of hotels and restaurants that are going to close, that aren't going to be able to afford to stay open. And we already had 2 premier hotels close here in Albany County, and restaurants that aren't going to make it through the winter. This is going to be a fact of life. So it's going to be a struggle for a long time, but we can get through this working together with Rockefeller and the people on this Zoom call, coming up with ways how we can reinvent ourselves, because this is the best nation in the world. And we are, we are what, there's only 330 million of us compared to like India, China, and Russia. And yet we're so much farther ahead in a lot of ways because we got the best institutions in the world. Thanks, Joe. I could keep going. I just don't want to take up everyone else's time.
No, thank you so much, County Executive, not only for putting words to this, but also for your leadership. It means a lot as an Albany County resident personally. So thank you.
Thank you.
So next we'll turn to Barbara Gwen. Barbara Gwen is the Executive Deputy Commissioner of the Office of Temporary and Disability Assistance, OTDA. In this position, she reports to the Agency Commissioner and oversees all agency policy and operational divisions. OTDA is responsible for a range of critical services and benefits, some of which County Executive McCoy just talked about, available to help New York State residents meet their basic needs and achieve financial stability. These programs include SNAP, public assistance, supportive housing through the Homeless Housing and Assistance Program, energy assistance, refugee services, homeless shelter oversight and services, and child support services. Barbara previously served as OTDA's Deputy Commissioner for the Division of Integrated Family Assistance Programs and other positions within the agency. Prior to joining OTDA, she was responsible for employment policy for recipients of public benefits at the New York State Department of Labor and worked for the New York State Division of the Budget. Barbara, as a good friend, thank you for joining us.
Thank you, Joe. Okay, let's get this started. Yeah, thank you. I really appreciate you inviting me to be part of this today. Okay, so I am going to just quickly run through some of the unique challenges that we all faced as part of COVID-19, review a few very high level, very limited number of examples of how our agency responded to COVID-19, and then also talk about some of the lessons learned that we think should be retained that present opportunities for all of us moving forward. First, kind of the unique aspects of COVID-19. I think many of us who have been in government for a while have dealt with emergencies, but this emergency was clearly unlike anything we've dealt with before. First of all, the scope of COVID-19, it was statewide, which again is very different than maybe what a traditional emergency, perhaps a storm in an area. Because it was statewide, we couldn't simply just shift resources to one area to kind of focus in and target and address that area. So very differently, it eliminated that option. The urgency and duration of COVID, certainly very unique. It came on relatively suddenly from the first cases in the state of New York, and then just about 2 weeks later, shutting down all non-essential business throughout the state. So it came on suddenly. And unlike a storm, again, it wasn't over. There continued to be a lot of uncertainty. We didn't know how long things were going to be kind of in an uncomfortable place. We didn't know how bad things were going to be or when they would get better. So that, again, was very unique with COVID. And then, of course, the economic impacts of COVID, long lasting, unfortunately. Speaking of the economic impacts, I mean, again, as far as what OTDA does, one example would be the administration of Supplemental Nutrition Assistance Program, benefits to help people purchase food. Again, County Executive McCoy certainly is involved in this, as each county is responsible for helping people access those benefits. Pre-COVID, down here, these first 2 bars, that shows our daily number of applications we were receiving throughout the state for SNAP benefits. So about 14,000 new applications each week. And then as soon as COVID hit, we saw a dramatic rise in the number of individuals seeking SNAP assistance. So, doubling within the first week that the state faced kind of the shutdown of non-essential services, and then almost tripling after that. So at the same time that the need is really increasing, we're all facing significant workforce constraints. So it's kind of a double whammy. Obviously, we had our workforce. We're trying, we, just like most counties, were not well equipped to work remotely. We had very limited number of people from our agency who were well equipped to work remotely and access various systems with high levels of security. We just weren't equipped that way. So at the same time as we're trying to move our workforce so that they could work remotely, as the counties were doing the same thing, we're facing increasing need and demand for services. So, one thing we knew early on was that communication was really important. Again, it's a time of uncertainty. Communicating with staff, communicating with the important partners we have in our local social services agencies, and then obviously other partners, including our contracted vendors who directly deliver services throughout the state. So we tried to keep communications open, again, knowing there was a lot of uncertainty, trying to make people know this is what we're trying to do to help you deliver services, to help us all deliver services, and then listening to them. What do we need to do to help you so that we can keep access to benefits? Again, with social services, these are essential services. We couldn't just shut down. That simply was not an option. People needed our services more than ever. So as people are trying to work remotely and to get to that place, in addition to supporting counties with technology support, which I'm sure Jeremy will speak to quite a bit, we also needed to move quickly to make significant changes in policies and procedures so that access to benefits were retained and that we were doing everything we could to reduce the likelihood of transmitting COVID. So this included seeking federal waivers for different program requirements, emergency regulations, policy issuances, and of course the important emergency orders from the governor. The executive orders were key. Examples would be significantly reducing documentation requirements, knowing that it was more difficult for individuals to get documents they needed to prove eligibility in certain instances. Also, we moved from what was always a 100% face-to-face requirement for an interview for public assistance to permit those interviews to be conducted wholly by telephone. Again, many streamlining processes for the applications, and then also, of course, provided for very broad-based good cause for clients who may not be able to meet program requirements, because we didn't want that difficulty to prevent them from receiving the services that they need. A couple of examples from OTDA in terms of the direct services that we provide, in addition to the oversight of certain county operations. We have an Office of Administrative Hearings, and they hear cases of people who want to challenge a decision that was made on their case for various benefits. We equipped those staff with the technology and the training that they needed so that we could move what was previously, again, almost wholly face-to-face hearings to telephonic hearings. We had zero capacity for telephonic hearings before this, but we were able to move very quickly in order to put that into place. And in addition to kind of changing the way we did business, COVID also brought on the need to do new business. OTDA, was very happy to be charged with administering certain new COVID-specific federal benefits for nutrition assistance. These benefits totaled over $1.5 billion for residents of the state of New York. But to do so meant, again, we had to come up with new policies and procedures for getting those benefits out. And in some instances, we needed to stand up a new hotline for a benefit that we are charged with issuing, which is intended to replace free and reduced price school lunch meals that families otherwise would receive except for school closing. So we had to stand up a whole new hotline, and we did so quickly, and we're still operating that hotline today, addressing over 9,000 calls a day. So it's been quite the effort. And then again, the work continues. There's going to be new needs emerging as we work through the crisis. Just in terms of reflecting on some of the positive lessons we've learned and things that we, need to keep in place and to embrace some of the things that we've learned through COVID. Clearly, like everyone, we know we need to retain our telecommuting capacity and related technology. We can't go back to ground zero if this happens again. And on top of all the other reasons why, having telecommuting can help with a lot of other reasons with attracting and retaining employees. We also need to, because of telecommuting, I think continue to improve how we measure our work products, both for accountability, just from a public accountability standpoint, but also to make sure our staff are very focused and they understand what the objectives are, and that we help them to be as productive as they can be in a remote environment. And then again, I think as County Executive McCoy said, we all need to really learn and continue to evolve in terms of our ways of communicating and coaching individuals, both from a remote workforce standpoint, but also in terms of retaining some of the urgency that we've been faced with and to keep that pressure going forward. But clearly coaching new staff and developing staff in a remote environment lends a lot of challenges. And I know that we at our agency intend to move from what's been a more informal process to a much more formal training process for supervisors and managers. And then lastly, of course, we know that some of the policies and procedures that we put in place that have improved access to benefits, we certainly want to continue those procedures so long as it's not undermining service delivery and that it maintains program integrity. Clearly, those are two key other elements in addition to access that we want to make sure we retain, and then continuous improvement in terms of our online services. I think that through COVID, a very positive is that we learned that we are nimble, we can be very creative when we need to be. An example would be we put up, along with working with our partners at ITS, an online application for one of our benefits programs that didn't previously exist. And we were able to do that because of the urgency within 8 weeks. Absent that urgency, it probably would have taken us at least a year. So I think now we know we can do better. We know that we can act quickly when needed. And then lastly, I would just say that, our mission, it was great to see our staff, managers, line staff, everyone stand up. They knew that it was really important as government employees and the mission that we have to meet people's needs, how important that was. The mission really motivated people. And I think that knowing and seeing how we've been we didn't sit back, we definitely all stepped up. And I think that even outside of an emergency, that's something that we can look on and hopefully continue to really operate in that way. And not so much as a public health emergency, but when someone walks in the door, that individual, that family may be in crisis, and that's their urgency. And we really need to respond appropriately. So thank you.
Thank you very much, Barbara, for the millions of New Yorkers you've helped and for your leadership at OTDA and for sharing some insights over the past 6 months.
Thank you, Joe.
So next we'll hear from Jeremy Goldberg. Jeremy Goldberg is the Deputy Secretary for General Government, Technology, and Innovation for the state of New York. He's also the Interim Chief Information Officer, or CIO, for the Office of Information Technology Services. With over 15 years of experience working across sectors, Jeremy has served in technology leadership, strategy, and partnership roles in 3 mayoral offices, New York City, San Francisco, and San Jose. Most recently, before his state service, he served as Deputy Chief Technology Officer and Managing Director of New York City X in the New York City Mayor's Office of the Chief Technology Officer. He led the successful creation of an award-winning portfolio of initiatives that focus on bold ideas and breakthroughs in the way we interact with and influence emerging technologies for the public good, which is obvious why we would want him to talk today, because those technologies and solutions are now needed more than ever. We're looking forward to your presentation. Thank you for being with us, Jeremy.
Thank you, Joe, and thank you to the Rockefeller Institute to be able to join here today. Barbara, and to Commissioner Hind for your great partnership throughout the pandemic and an ongoing basis. It's really truly emblematic of the hard work and the things that we're getting done here for New Yorkers. So I'll briefly just start out by level setting on 3 challenges that governments face. First, demand spikes. So in a crisis, demand for government services spike related. And if those services are unable to scale to meet that demand, they will fail. Rapidly changing situations. The situation can change on a day-to-day or an hour-to-hour basis. And governments need to be prepared with technologies and resources that can change that quickly. And the third challenge that I want to outline is urgency. And in an emergency, as the two prior panelists already described, residents cannot wait for the information or the services that they. Next slide, please. So in response to these challenges, ITS, the state's information technology organization, needed to go beyond planning and getting right to solutions. We needed to be both flexible and fast. And the world, the state in this case, is very rapidly shifting or shifted to supporting remote work. And we did this across agencies by expanding capacity of existing solutions that were immediately available. And we recognize that some agencies may be better equipped from a remote work arrangement than others, and we did our best to meet teams and staff, key personnel, where they are. So how did ITS do this? Well, we leveraged, as I mentioned, solutions that were already in place to support remote work for a segment of the workforce. And where we needed to, we expanded or increased capacity. This includes provisioning hardware, tablets, laptops, phones. This was a 24/7 operation. We also leveraged virtual desktop infrastructure, or VDI access, which is secure and enables remote desktop access for staff to continue to conduct critical business for New Yorkers. And as a prerequisite to utilizing that remote access technology is the added layers of security by leveraging RSA tokens. That's two-factor, multi-factor authentication. That could either be in the form of hard or soft tokens. And certainly we can apply what we've learned and improve these processes moving forward, but there was no time to reinvent the wholesale, everything wholesale in the moment. To complement a lot of this work in the move toward remote, ITS put together trainings, some of which had already been leveraging in-house during other periods of time for the workforce, and others that brought on external partners. And these were targeted to improving the workforce's ability to work remotely, including training on software like Microsoft Teams, and competency around areas like time management in a remote setting. Now, when it comes to assigning resources to and solutions to the areas they are needed most, ITS teams really responded to demand in two major areas: government services and information. And our digital team led the charge on updating our web platforms from the COVID-19 website to the New York Forward website, and updates and adjustments to the DMV and DOL websites. The work took around-the-clock coverage, but our web platform, a Drupal-based platform content management system, was well-suited for this fast pace. We also engaged outside resources through the New York State Tech SWAT effort, which is a pro bono public-private partnership effort that's first in the nation. And it brought in additional resources and assistance to the state, as I mentioned, on a pro bono basis. Some total of about 35 projects across the state enterprise, in total around $14 million in pro bono or volunteer value dedicated to these efforts. For example, leading to the online COVID-19 screening and scheduling tool, which is still up and running today. Next slide, please. So when it comes to moving fast and getting things done as though it needed to be done yesterday, and considering this in terms of product agility, the path was really to leverage software solutions that allow updates with little or no code, as we call it, because they allow for websites and applications to be changed much more quickly than those requiring a lot of developer intervention at every single step. So we're talking about web forms and surveys, and some of which I think you'll hear from my colleague Madhuri following my presentation. Coders who are really limited, there's a very limited resource pool of those, need to be worried about other things during the emergency. And they're not called on to spend on time on something that can't be done without their expertise. So when there is new code needed, both the infrastructure and the process in place need to support rapid deployment. And finally, on speed, looking at options to leverage what we would call infrastructure as a service or cloud-based solutions, infrastructure needs don't need to slow down your response or prevent people from accessing the information and services that they need. Demand, in this case, when we look at cloud-oriented infrastructure as a service approaches, is distributed across the enterprise, meaning much higher capacity and resiliency for all applications. Additional capacity can be added across the system, much more cheaply and efficiently, and happen dynamically as the demands shift or change. So it is much more flexible, meaning that we can update these things quickly. They can be deployed when they're needed most in a crisis. And as the ITS CTO would probably tell you, capacity could be scaled up and down. And that means not only do we avoid an overwhelmed system when demand spikes, the requests spike, but it also means we scale down and save money when demand is low. Next slide, please. So while this is all significantly challenging and everyone's burning on both ends here, I really think it is important here, and I am ending on these comments on a positive and optimistic note. The transition to digital infrastructure as a service can't be made overnight. It will require investment of attention, time, resources. It also requires a change in approach, some of which we've already been doing, and mindset, because we have to get it done. And that transition, must be an intentional choice, and it transcends the need to replace a single piece of old legacy hardware or rewriting software built on decades-old code. It's really a move that shifts the playing field to solve both an acute problem that's made apparent, in New York and in other states by a crisis, and prevents a state from finding itself in the same place the next time. So unlike many industries, which we have to react in ways that fundamentally run against their usual business model and customer desires, all of the above are really both necessary for responding to a crisis and in line with better digital government and leadership that has already proven itself here under the leadership of Governor Cuomo in normal times as well. So government with technology that is well positioned to withstand a crisis is also one that will be equipped to provide residents with better services all the time. So thank you.
Thank you very much, Jeremy. I appreciate your thoughts and also your leadership at ITS, being able to translate demands in real time and match them with solutions. I think we'll talk about that a little bit more, but thanks for joining.
You're welcome.
Next, we'll hear from Madhuri Kamareddy, who is the Director of Workforce Development for New York State. Madhuri previously worked at BlackRock as Head of Credit Investor Relations and Product Management, and at the Clinton Foundation as the Director of Job One and the Director of Program Development for the Office of Hillary Rodham Clinton. Earlier in her career, Madhuri served as Director of International Economic Affairs at the White House National Security Council and National Economic Council, Associate Staff Secretary in the White House, and Policy Coordinator in the Office of then U.S. Senator Barack Obama. We appreciate you being with us today and your perspectives. Thank you, Madhuri.
Great. Thank you so much to Joe, the entire Rockefeller Institute team, and of course the other panelists who have really hit, I think, a lot of the themes that I'm going to delve into from my perspective as well over the next several minutes. If we could go to the next slide, please. Great. So what I'm going to do today is just talk about three themes that really, I think, characterize some of the work that me, my team, and others did over the past several months as we were thinking about how to respond to the COVID-19 crisis. The first theme that I'm going to focus on is really how we make use of flexible processes, which is something that Jeremy and Barb had also discussed as well. And I think in some cases, we may not realize how much flexibility we actually already have. So I'll talk about that first. Second, I'll talk about how we really did rapidly deploy to meet some of the challenges that we faced that we never expected that we would face as a state as we went through the COVID crisis. And then finally, I'll talk about the importance of ongoing engagement, which not only helps set us up for success during the COVID crisis, but also now is really helping ensure that we build back up better, as Governor Cuomo has asked us to do. So first, I'm going to talk a little bit about how we really identified and made use of flexibility that in some ways we didn't even realize we had until we were faced with this crisis. So first, let me give you a bit of an overview about Governor Cuomo's $175 million workforce development initiative, which is something that my team oversees. This was an initiative that was launched last year to really address the ongoing business concern with finding and retaining skilled talent so that New York State's economy could continue to grow despite the really tight labor market we had prior to the COVID crisis. This initiative brought together 5 different agencies, from the Department of Labor to SUNY and CUNY, and also included input from the 10 regional economic development councils that we had across the state. What we realized when the state government, as well as the state, were starting to move towards remote work was that thankfully a lot of our processes didn't need to be affected because we were working across agencies, across state lines, and with a variety of different stakeholders. Most of our processes were online based, or they were based via telephone calls and via systems that we had built so that everybody could work collaboratively across the state. So that's something that was really a benefit that we realized, is that, wow, our processes, because we've tried to already build an integrated state network, are already something that translates well to the COVID crisis. However, as we started to think about the substance, that's where we got a little bit more challenged. As we started to receive a lot of queries from our applicants who have applied for this funding about, could they adopt their programs to include remote work? How should they think about the new economic demands that have been created? As certain industries have continued to struggle, of course, we have new industries that have popped up or are starting to scale and expand. And so how do they kind of think about how they adapt their applications to meet this growing need? And initially, we thought we were going to have to update our program guidelines and issue new guidance to our applicants so that they could have this kind of comfort and security of figuring out how they could adapt to the crisis. Because we, of course, want to make sure that state dollars go to real economic needs and demands. However, as we actually took a look at some of our guidelines, what we realized were a few things. One is that we already had baked in a lot of flexibility into the process. And so really we allowed people the opportunity to actually shift to say, well, we initially identified X or Y need, now it's Z need that exists. We actually have that flexibility so that applicants can already change their applications to meet what's most important in their local communities. Second, we really also took a agnostic view as to how best practices really could work. As long as an applicant could articulate to us how they thought a remote training could work to meet the economic need, that was fine under our current guidelines. And it's something we had each agency go through and see, is there anything that we're doing that's prohibiting individuals from operating in this new environment? And thankfully, we found, because of our focus on flexibility on the front end, that wasn't the case. And then 2 other things really became more key through this process. One is that because we really engaged the regional economic development councils in this workforce development initiative process, we really started to create stronger communities of practice around workforce development across the state that really focused not just on the training community, but the business community, the academic community, the nonprofit community. So we're able to build a lot of cross-sector ties that people were able to leverage through this crisis. So some organizations realize what we really need now are devices, because our applicants that we're serving, the clients we serve, don't have devices at home to be able to do remote training. And thankfully, we're able to point them to other partners in the community, some of whom they've already met through some of these processes in the past, that they could work with to leverage. How do we actually get the devices or maybe connectivity or other challenges kind of addressed? So really building those strong communities of practice and building up relationships within communities allowed organizations to pivot a bit more once they realized what they were good at and what they were less good at. And then similarly, that's also where our emphasis on ongoing business engagement became very key, because businesses were able to tell us pretty quickly about what worked and what didn't in this new operating environment. And then particularly as we started to reopen and rephase, creating that kind of connectivity between businesses, training providers, and academics has been a bit less kind of fraught than we thought, because people had those lines of communication early and recognized that they had to adapt. If you can go to the next slide, please. The second thing that I'm going to talk about is really how did we rapidly deploy to meet new challenges? And a lot of this work is in great partnership with not only the folks on the panel today, but particularly I want to kind of call out Jeremy's larger team at ITS, who really were critical across every state government initiative as we were thinking about not only how do we move our existing work to meet the COVID response, but also how do we create new projects and new capabilities. So I'll give you two examples of what my team worked on during the COVID crisis, and in some ways continues to work on, that really required us to make use of the tremendous resources we have across state government. The first example is the creation of the new state medical professionals portal that we created to recruit and place medical professionals across the hospitals across the state who are starting to create more beds, also the new surge healthcare sites, our testing sites, and then ultimately contract tracing, which I'll talk about in a minute. Ultimately, we were able to build a system that brought in more than 97,000 medical professionals who said that they'd be willing to work in a COVID or ancillary COVID-related care kind of space. And it was incredibly exciting to receive that kind of volume of feedback from people, not only across the state, but across the country and the world. But that created a major logistical challenge for us, where we really had to figure out what is the best way that government can meet this need versus how do we bring in other partners to really make sure that we're building a system that works for the patients on the ground, as well as the institutions that are providing direct care. And so what we ultimately did was we got very creative with identifying where expertise existed across New York State agencies. First, we relied on the Department of Health and ITS to really design and set up a system that, based on the input of individual hospitals, hospital associations, nursing homes, and other parties, could really meet their needs. How could they best find those candidates that were going to meet what they were seeing as growing demands within their care facility? We also found a data science team that we did not know existed in a state agency to really help us scrub this massive amount of data, some of which was pretty high quality, and some of which individuals filling out a website may have had a lot of gaps. So we engaged a data science team to really start scrubbing this massive amount of data to make sure, again, that we were building a system that really worked to get these professionals to where they were most needed. We also built a team of vetters and a call center that was stood up to help individuals navigate all these state resources. We included this call center and the set of vetters to make sure that these professionals were what these institutions needed, and to make sure we could reduce the time on their end to then vet and place individuals. I'm pleased to say we had hundreds of individuals across state government who participated in this effort, many of whom were doing it at night, on weekends. Similar to what Jeremy said before about the ITS capability, we had state employees working around the clock on top of their regular jobs to really support the state during this time. And what we were able to find is that individuals, in some cases, like the data science team, were really using their workplace capability to address the challenge in front of us, but other individuals got more creative and said, well, we may not know how to do this specific skill, but we bet we can figure it out. And so we had great communities of practice also developed within New York State government to trade best practices. So we received a lot of feedback, for example, from the call center to say, this question isn't working, but three of us, kind of figuratively, not literally in the COVID case, put their heads together to figure out what are the new questions we should be asking, which really helped us continually improve and really speak to the rapid deployment. It wasn't just a top-down effort, but really something that got improved because individuals across state government felt that they were owners in these new processes, which was key. And I think really speaks to something that Barb was saying earlier, which is we showed the best of government as being mission driven. And we really brought that out of the state government workforce, who saw that they could be partners, leaders, and collaborators to make sure we could rapidly address these challenges that we were facing. Similarly, we had to continually iterate as new needs were constantly identified. It wasn't just standing up a portal and saying, we have 97,000 people, find who you need. Rather, we really tried to target where are we seeing needs, which evolved on a constant basis in terms of what staff members were needed. Initially, our focus was really on respiratory therapists and individuals who experts are saying we really needed to respond directly to individuals who had severe COVID cases. But as time went on, we started hearing from hospitals about the need for dialysis nurses and other types of individuals who can provide more long-term care to individuals that we hadn't initially expected. And so we really worked, again, across state government to reach out to organizations and individuals with those capabilities, better identify those capabilities within our system so that then hospitals, nursing homes, and other institutions could more easily access the people that we needed. And ultimately, this, I think, was a success because of ongoing feedback with those stakeholders. So again, something that not only people individually in state government did, but also we did across our series of stakeholders who we work with and newly developed relationships with as part of this effort. The second example I'll give you when it comes to rapid deployment of a new challenge that we never had anticipated, or at least I hadn't, maybe others have, but I hadn't, is the contract tracing program that was set up. And I'll just speak about two elements of this program. One is really the need to identify individuals who would be good at this type of position. And how can we spread the word to qualified candidates that this is a new job need within New York State, and to really get people to sign up so we could start to rapidly deploy this program as we were starting to reopen the state's economy. We were able to not only use this new portal and really use the data science team to help us figure out what are the skills and characteristics we should be really kind of searching for to identify who would be good applicants for this, but we also engaged the Department of Labor as well to really take a look through their job bank and other mechanisms to figure out how do we map skills that we know from other industries will actually make a person a good contract tracer. And so we're able to reach many more people than we would have otherwise because we're able to use our data, our science teams, and the expertise of state experts to really address this challenge. And then finally, I'll just touch on training as well, which is where in some cases, as you've heard, within state government, we found a lot of tremendous resources to help us rapidly build up and meet these new needs. But in some cases, we didn't have the capabilities in-house. And so what we did was partner with individuals and institutions that did have that expertise and were willing to deploy it to the state. And I think a great example of that is the Johns Hopkins partnership on the training program for contract tracers, in which we really utilize the best experts in the world to develop what is the best type of training, how do we make it accessible, how do we make it free, and I believe is being used across the United States today, which is very exciting. So the third theme that I'll connect on the next slide, please, is really what made this successful. And some of this you've already heard me talk about, but I really wanted to emphasize this as its own standalone topic because it really underpinned not only the success we've had to date, but what will make us successfully build back better as we think about the post-COVID timeframe. It really is ongoing engagement, and more engagement than we had had in the past. Barb had mentioned earlier that in some cases, projects that may have taken years to do, we were able to do in months. And I think that certainly was the case in the COVID crisis, not only for the new projects that we've developed and deployed, but also for our existing processes and programs. And what has allowed us to do that is really thinking outside of the box in terms of how we engage both internally and externally. So from an internal perspective, we really started to source and be aggressive about sourcing from different agencies that we work with. Where are some of our past practices not really working? And in some cases, what we learned is that they weren't really working that well before, but they really kind of fell apart during the COVID crisis. So how can we actually now identify them, but then start to change what those look like? Similarly, we also tried to take a look at examples and look at the what happened in the previous recession to learn what worked and what didn't. And I think that's something that has been particularly successful as we're thinking about how we can best deploy new programs to help with the recovery. And what we found is that there are a number of individuals across state government, some of which are still in the same agency, but some of which have moved on to other agencies where we're trying to capture that experience at the very granular level of what worked and what didn't. And that can only really happen if you're very aggressive about reaching out and finding who those individuals are, which I'm happy to say that our team has been doing. And then the second and last point I want to make is just the importance, again, of external engagement. We did this not only throughout the crisis to make sure that what we were doing actually was meeting the needs on the ground, but we're trying to do that now as the crisis kind of continues to change in terms of its form. So an example is, of course, that businesses and training providers, when it comes to workforce development, have actually learned a lot already in the past few months about what works and what doesn't from a remote perspective. And so that's been something that we're trying to capture and, again, be very aggressive about capturing now so that when we put out new programs and guidelines, it reflects those best practices. We're also trying to hear from new voices and more voices than we've ever heard from in the past. And that includes individuals who are actually directly affected by our programs, which I think is something that Barb spoke about as well. So rather than just relying on associations and kind of top level groups who generally engage with government, we're trying to get a lot deeper and hear directly from people who are going through training programs, individuals who are enrolled in community college about what their experiences are, so we can continue to build back better. So with that, I'll turn it back over to Joe so we can get to the Q&A session.
Thank you so much, Madre. I appreciate your perspective and position. And I think it's very timely, all of the things that you've done on workforce development and connecting and matching the needs to where people can bring their talents. So thank you. So thank you all for sharing your insights and perspective. Coming out of those presentations, I think there are a few buckets of management lessons and approaches that you've all kind of touched upon, which I hope we can discuss further. I think largely we talked a little bit about them, but workforce being one, how do you start to approach from a state agency or a local agency perspective, deeming essential versus non-essential personnel, transitioning to a remote work environment, and starting to think about using the flexibility that's already there in terms of alternative work assignments and arrangements. The second kind of bucket is in terms of services and programs, ensuring that there's continuity of what's essential in terms of the services and programs, but also that those services and programs can adapt to meet surges in demand. And demand, we've seen from a few of the panelists, whether it's SNAP benefits or inquiries for a new website, or as the county executive was talking about, request for virtual check-ins and probation, all of that means a demand for a new type of service or a service that's delivered in an alternative way, as well as information for the public so that they can build trust and confidence in government response. And last is virtual access for the constituents and public. How do they access benefits and assistance more remotely? I think the DMV has been an example of that in New York State as well, about how to transition services that are typically take place in person to a remote and virtual environment. So finally, I think all of the panelists stressed and what the governor has kind of charged to build back better, to use flexible tools and technologies, including those that are at our disposal already, in new ways to provide better customer experience, but also provide the services that New Yorkers need. It's about stakeholder engagement, whether that's internal, developing teams and community of practice, or external in terms of engaging with the public, which I know County Executive McCoy often has his daily press conference, engaging the public, providing information, and sharing new news. And then sustaining the changes that we've all worked so hard to implement and make sure that we're adaptive to the challenges of tomorrow. So as we transition to the next section, and next slide, please. Please remember, audience members, to submit your questions through the Q&A function at the bottom of the webinar. And I'll start with one question, and this one's for County Executive McCoy and Barbara. So for 6 months, the virus has impacted every aspect of daily life, the way we socialize, work, play, and learn. But before we discuss the larger impacts, particularly in government, what struck you the most about the start of the crisis going back to the early days of March? And County Executive, I know you talked about this being a father. What struck you about those early days, which now it seems like we're at March 194. But would love to hear from you and Barbara on that.
Would you like to go first, Barbara?
You certainly go ahead, County Executive.
It's the way things were going to change. And that's when I started to realize that the world that I'm adapted to is going to be different. And not just for me, but for children and adults and everyone else that in the beginning struck me the most. And as the days start to go on and we're going through this crisis and we're, everyone on this call was going around 7 days a week, no days off. And our office was like that for a while, was that the impact it was having on my children. And I have a 25-year-old, 23, and a 16-year-old. So watching 3 different age groups affected differently, that age group of kids. And that's why early on our dashboard, I started watching the kids between 20 and 29, because watching these kids saying, okay, I have no signs or symptoms, and I can go out and continue to live life because nothing's going to change. I'm not getting sick. And then seeing my 16-year-old dealing with it differently than my older one. So to me, it really made everything come into to realization that things got to change, and this world's changing, and we have to adapt to the new changes.
I would just say, looking back, in terms of how, when the crisis began to unfold, and kind of looking back on it, it's like, as America, in some ways, it's like we were isolated from what was happening in the rest of the world. And, we definitely, I think it highlighted the importance of competent leadership. And, we need a government, we need a federal government that's honest with us, that trusts us to be able to handle the truth and to act responsibly. I think we were fortunate in New York to have that competent leadership and governance, and just how important government became, and some of the basic things became. Again, we went from, doing different things all the time to becoming, most of us, we were at work, or you were at home. So, and we became much more isolated in that sense, and moved away from, a lot of materialistic things. We no longer went out shopping unless it was for basic necessities. And so kind of looking back at, okay, what's really important, and, realizing, too, how when it hit, how it hit different communities in different sectors of our society so differently. And one might say in very unequal ways, in terms of especially the people who no longer had jobs, obviously a lot of service sector, retail, folks who may have been living day to day that no longer had employment, and didn't have the opportunity to work remotely. I think, all of those kind of strike me as kind of in the early days, and so many changes that we all faced, just really significant changes that all happened really quickly.
Thank you very much. County Executive and Madhuri, I think you both mentioned a little bit, and Madhuri, I know from your prior role in the White House, and you've talked a little bit about economic conditions and 2008, what that recovery looked like versus what we're kind of working to recover from now. And so with millions of jobs lost, with significant unemployment and lagging consumer confidence intervals, how do you start to approach and factor in fiscal challenges when you're thinking about the delivery of services and programs? And then, Madhuri, I think there's a question from the audience on, is the network of REDCs that are mobilized across the state, a vehicle to help respond to the crisis on the workforce development side? Madhuri, do you want to start?
You want to go first?
Yeah. I got the two questions, so I'm happy to go first. On the latter, let me start with the latter and the regional economic development councils, which, as the crisis hit, really pointing to the last question, we had severe disruption of individuals' lives and businesses across the state. And our REDC workforce development committees really kind of were juggling just a tremendous amount with their day jobs, with their personal lives. And on top of that, we're still very much committed to making sure that they were reviewing our applications that were coming in for funding. And then subsequent, over the summer, we received a lot of detailed reports, and I believe from actually every REDC workforce development committee in the state, about what they're seeing locally. What are those different economic trends that they're seeing? What are the industries that have been most hard hit? Some of which we do have consistency across the state, but in other parts of the state, we've seen some uneven or kind of just different levels of recovery, which has been really helpful and interesting to see. Finally, too, they've also been very helpful in identifying where potential solutions are. So to the fiscal question, as we're continuing to apply for various federal and other resources, having that REDC input about where are we seeing recovery and what is effective in the new socially distanced world that we're in has been invaluable insights to us. So really, we continue to thank them for their hard efforts. And in terms of the fiscal crisis that we're in, obviously the fiscal crisis is on all of our minds. It is affecting our work, and it's something we could be put kind of top of mind in a way that perhaps when the economy was the strongest it's ever been was not as much a concern. And so for us on the workforce development side, it's encouraging us to do two things. One is to really focus on what we know works, which is where having that constant business and employee engagement has been incredibly helpful about, actually all remote doesn't work, but here's where 75% remote learning can work. And here's the 25% that we do need to have in person in a socially distanced way. So getting that feedback has been helpful to dispel, I think, some notions that not only we've had, but other funders, philanthropists, and others have had about what moving to the new world is. So focusing on best practices. The second is also just focusing on what we know works. So SUNY has a fantastic campaign that they've launched focused on our community college system, which really does extend across every part of the state. In CUNY as well, we have a tremendous network of community colleges. So students have been thinking about, what does college look for them now? For those who are experiencing unemployment, what does training look for them now? Really kind of pointing to resources we already have that can be scaled up and can address this moment is something we're excited about. And I think similarly, SUNY Online, also something that we're really excited had launched prior to the crisis, but can be scaled kind of infinitely in this time.
So, just to go off of what you just said a little bit, when I watched the recession from 08, 09, and we came out of that, and, we lost a lot of jobs then, not as many as today. I watched college kids come out that were making typically $60,000 to $70,000 a year, drop down to $40,000. Jobs were created, and I think one of the things, I don't know, it was one of the TV reporters, Steve Hughes, or the editorial, I forget the article, and they talked about jobs being created again, but making sure that they're paying jobs. And some of the issues that we had going forward as new job, we're at a place right now, a fork in the road with companies that are going to not make it, companies that are going to start up. What's that going to look like for college kids coming out of college that graduated this May through all this? Are they going to have an opportunity to get a job right away, or are they going to stay unemployed for a year? And my son, who graduated last year, is living in Boston working. 50% of his company got laid off through this, and they slowly got hired back. But he got laid off and hired in another job for like $5,000 less. And these are things that we're going to see. We went from a market where everyone was employed. It was the lowest unemployment rate ever, and now we're at the highest rate ever. So as government officials, as we go forward, working with the private sector, is to create these jobs, bring them back to where they were, but the paying jobs to come back. And that's the only way we're going to get through this, working together. And the other biggest issue I saw with smaller companies trying to applying for loans, they didn't know how to fill out the applications. They didn't have the resources to get online, to get the aid if there's any aid out there. And we just got to do a better job of working with the smaller companies so they can get taken care of too, to get to move on, to go forward.
And County Executive, on that note, is this something that you've also, engagement with other county executives from across the country? Does this seem to be a challenge that's rising to face all local governments in some way?
Absolutely, and it's something that we've talked about, not just here in the state of New York. I've talked on a national level, what's worrying everyone, and that's why I said to the one reporter at that time, I go, I'm more worried about 2021, 2022, and 2023, because this is going to have a domino effect where, if a hotel doesn't open up, there's a lot of jobs associated with the hotel. There's a lot of banquets, a lot of workers. It's a trickle down effect. So as we continue to move forward, we have to be resilient, as Governor Cuomo says, and we have to be there to support these businesses that are the mom and pops in our backyards to make sure they get the resources to stay open and let them know what they're entitled to, because a lot of them, when I talk to them, they're devastated. They don't know. Even after some of the riots and stuff like that, they had no idea the help they could get, who to call, because they never had to use government before. They've been in the private sector their whole life, and now they're sitting there going, how do I bounce back from this? And when I met with bar owners and restaurant owners that were practically crying to me, saying, if I can't get back inside by the winters, and we get tough winters here, I'm not going to survive through the winter. I'm not going to make it to next year. I just can't pay my bills. So even though we're in this COVID-19 world and the economy crisis, this is more time. This is the right time for all of us to get together in a partnership, regardless of party affiliation, to work for the people, to give them the support that they need. And I compliment the governor for taking his team that's on here now, reaching out to people.
Of course. And Jeremy, I think, it would be great to hear your comments on this as well. I know in your presentation, you talked about how no and low code solutions and scalable solutions can be right-sized based on resources and based on demand. And so it'd be great to kind of hear your perspective about how the financial condition might factor into the ITS solutions that are delivered.
Sure. So and I agree, like there's a layer here of technology that can help processes and services, run more efficiently. And we understand certainly that the fiscal environment and the resourcing constraints are going to continue to be, a challenge. And so when we think about it, I subscribe to the, people first, process, product, or technology methodology, because often we tend to jump ahead to the solution, the product. And without the two former pieces of it, we're going to run awry in terms of what it is that we're trying to get done. And so I think now is really, it continues to be a great moment to carefully look at how to best allocate, our spend in our budget and the resources to meet the moment, meet the needs. And sometimes that is low code or no code kind of options. And, often these changes can require the collaboration across agencies, and finding the right technical solution is just one part of the puzzle. On the external kind of collaboration pieces, this is what I kind of posed earlier is, when the governor had the foresight and the state to launch the NYS SWAT team and focused on technology solutions and, the projects that ranged, from the COVID website to the New York Forward website business reopening widget, to the NY Nourish platform, connecting farmers to buyers. The whole thing, the whole spectrum of projects demonstrates, I think, both one, the roll up your sleeves attitude and interest that people want to give back. That's industry, that's nonprofits, academia, and others, and really align with government to do things that are meaningful and impactful. And we had over 6,000 people, apply to be volunteers from across the state and join one of these SWAT teams. And so I think it's an indication of interest and ways of being more, thoughtful about how we get things done and how we're going to have to focus and lean into being great every single day with the new kind of fiscal situation that we face.
Thank you very much. So we have another audience question. When innovation is forced, as it is in a crisis, is there an evaluation component that needs to happen now as we start to recover, as we move from the direct response efforts to the recovery efforts? And is innovation that will continue, or do you believe that agencies will return to the status quo? And I think this is largely the kind of genesis of this conversation, but it'd be great whoever wants to jump in to talk about innovation, evaluation, and sustaining innovation in the future.
I'm happy to jump in and was smiling when the question was being read, because we have been well into evaluation, as you can imagine, on the new projects that we started as a result of the COVID crisis, particularly as we want to make sure that New York continues to be prepared for not only what COVID may continue to do over the coming months, but also for future emergencies as well. And it's something the governor, as you can imagine, has really made sure is a priority across all state employees and state agencies, which is to be in constant evaluation and improvement mode with an eye towards what the future is, to make sure we haven't lost these lessons learned. So evaluation is absolutely ongoing and really kind of is almost happening in parallel, even as we are launching a lot of these new initiatives. And then in terms of innovation, I do not foresee, and I'd be shocked if anybody on the panel would foresee that anybody's going back. I think we've just learned so much about not only the capabilities of our programs, of our team members, but also, of course, as Jeremy was just mentioning, the people of New York who've really volunteered and stepped up. So I can see in no scenario that we're going back to business as usual. We will definitely build back better.
And Joe, I'll add there, I think it is a tremendously challenging and exciting time to be working in government. And maybe we've said that before. And I personally believe in terms of government technology, this moment for people who are interested to get involved, who are in technical fields or project management, product management fields, this is a moment to get involved because they love problem solving and finding solutions and evaluating the needs and trying to solve the hard questions. And if you're motivated to solve hard problems and have an impact on people's lives, then government technology and being a part of this right now is a way to do that. And we could go back and forth on the definition of innovation. I think at the end of the day, what's been very clear is that there's quite a lot of get it done attitude, and sometimes those are new things. Sometimes they may be new innovations, but it's really the ways that we're thinking about and approaching the way that we size up a project, the way we scope it, the way we review it in terms of what the requirements and needs really are, which is, again, going back to the people, the process, and the technology parts of it. So, we're excited for those that want to raise their hand and jump into the deep end of the pool.
So staying on that subject for a minute, I think, attracting and retaining talent, this is something, Jeremy, you're talking about in terms of people who want to give back. And County Executive, you talked about how, college graduates are going to want to contribute and get jobs, and whether that's in the private or public sector. And so, I think we all kind of recognize that public sector employees are typically older, they've served longer in their roles, and there's a significant portion who are nearing or beyond retirement age. So with the rate of retirements likely to progress as the recovery proceeds, what's necessary to retain talent, but more importantly, retain institutional knowledge? And then how can we attract, using the options and benefits that are at the disposal of governments, new people, whether they're coming from the private sector or coming for the first job? So I'd open it to the County Executive first, and then whoever would like to comment.
It's an excellent question, and I have to say one of the things we struggled with when I offered the $15,000 buyout for people to leave was the fact of that I said the commissioner and their supervisor have to sign off on it if we eliminate this position going forward. But also I had people with institutional knowledge earn positions that you can't lose, that need to be there. And unfortunately we had to tell them, sorry, your position's too crucial, or that knowledge factor. And that's in government, that's one of the things we have to worry about, because and even in the private sector, when you have that key person working in your agency that let's just say is the backbone of that agency or has the tools to get things done, until you train somebody, you can't get rid of that position. So it's crucial to try to retain the people that we don't want to retire, and also attract the newer people that come in with newer technology. Kids look at it, I don't want to say kids, that makes me sound older, right? College kids that are coming out of school that have different technology skills or different ways of operating can teach us too. So trying to learn from the person that's been there for 20, 30 years to the new person that can contribute just as much to the team, but finding that balancing act between both.
Joe, I'll jump in. I would just add, in terms of retaining employees and also attracting employees, hopefully people can, look at their government and see that their government has been effective, and that will, again, want, folks to join the team and to do something that's really meaningful. I think, we also need to modernize to attract employees, to attract also, I think, a more diverse group of employees. And I think even remote work, even as kind of, it's not a technical issue, but I think government has been one of the last, industries to really buy into remote work. And certainly there are some functions that lend themselves better to remote work than others, but I think that we've learned a lot about where remote work can work and where we can offer that to give employees more flexibility, again, that life-work balance. And I think one reason government's been hesitant to embrace any remote work, even part-time remote work, is the feeling of the need to be really accountable to the public and not wanting anything that would undermine that accountability to the public. And I think, as the governor often says, you can say lots of things, but what are you doing? And so I think as long as we're demonstrating to the public that we're delivering services in an efficient way, we're meeting their needs, then you can have more flexibility there. So that's just one, kind of outside of the technology side of our need to modernize. I think modernizing some of our personnel practices as well would help us both attract and retain quality employees.
I couldn't agree more with you, Barbara. And I think that in many cases, and we've seen this at ITS, when the first phase, or whatever we would like to describe it as, of the response effort kind of has wrapped of sorts, I had the entire executive leadership team sit down, people who have worked ranging from 6 months at ITS to 25 plus years, sit down and do a post-mortem of sorts of all the products, the services, the communication flows, and talk through the areas of challenge, of need, of opportunity, of growth, because I don't know who's going to stay or who's going to go, right? And if we don't take advantage of the moment while we have people and it's still fresh in their mind and create a knowledge paper, this is a product, for us internally, then we're going to be in trouble for the future agency work that we do and the work going ahead. So if we don't know what we've learned, then there's no way we're going to be able to put it in practice for the next round of crisis that we face.
Great. So I think we have time for one more question, and I'll end on a positive note following your lead, Jeremy. So as public servants among us, first and foremost, what gives you hope and cause for optimism despite all the societal turbulence and uncertainty? I'd like to start with Madhuri, and then Barbara, then Jeremy, then the county executive.
So what gives us hope, Joe?
Yeah, what gives you hope and cause for optimism as you look out over the next 6 months, the next 6 years?
I think it really is, which like, as I say it, I feel like it sounds kind of lame, but it actually is true, which is that, Jeremy and I think everybody on the panel experience when things are really hard, people stand up. And it was really remarkable working on the medical professionals recruitment effort, where we really had just a tremendous number of people from, again, not only in the state, but around the country say, we see a crisis and we want to help. And people who really were like nurses who had children, young children at home, who were saying, I'm going to go into a COVID kind of a focused hospital now, and I will make it work because I know people need me. And I think it's not just the medical professionals, but across state government. I really, I think about that data science team within an agency that said, we don't know about public health, but we know data. Tell us what data problems you have, and we will help you figure it out. And we're doing this all night long. I was on the phone with Jeremy's team often at midnight on a Saturday night as we were trying to build these new products and services. And it gives me hope. That gives me a lot of hope, because it really, I think, it is the reason why all of us are in public service, because we know we can do great things if we get, people together and focused.
Thank you so much. Barbara?
Yeah, I definitely agree. I think that what we've all been through, we've seen ourselves and everyone around us step up, both within our immediate circles within the workplace, but also working with our colleagues. It's been really inspiring. I'm also optimistic, again, because I think that this crisis has brought to light some of the inequities that we need to address. Again, it's, the school system, in terms of some children who are at such a disadvantage to learn remotely because of their access to technology. That's just one example. We have a lot of examples of places that I think everyone realizes that there's some very, we have a lot of base level things that we know we need to improve. And I think we've demonstrated that collectively we can do an awful lot. And so I'm confident that we, as a state and as a nation, that we will be able to address those. And so that we're all, moving better in a better direction in a positive way.
Thank you. Jeremy?
Sure. And so, lots of things that I'm optimistic about, but the think COVID-19 put technology back on the front burner in states across the country. And thousands, if not tens of thousands of employees have been outfitted for remote work. Data has been on the front lines of understanding the spread of the disease. And states have vowed or have made commitments to modernize a lot of the infrastructure. And, crisis or not, I think states were already becoming a place where, innovation or the next hot spots for government technology would be taking place. And so I think that trend has only been accelerated by these events. And so over the next decade, whereas cities, and I had worked in a few cities prior to coming and working for the governor, I think over the next decade, states are going to be these centers of experimentation in government technology, and governors are taking the mantle from mayors in terms of technology leadership. So that's what I'm excited about.
That's great. County Executive, you have the final word. County Executive, are you there?
How's that? Got me
there. Thank you so much.
Talking about technology, I could have used it. Just to complement what everyone has said so far, to me was seeing the different departments and the continuity between county employees that have always worked together, but this really brings you together in an emergency crisis like this. And watching the bonding going on between people and the differences, you might have argued over somebody had something on their cubicle you didn't like, or you didn't like something, but it really brought people closer together and developed a lot of friendships and came up with a lot of great ideas of moving us forward, because you really took the time, because you just weren't there for your typical 8-hour day or 9-hour day. We were there for 18 hours and really listened to everyone. And if I take anything away from this, and I said this to my commissioners, is really even, and Jeremy said it, when someone at IT comes in with just 6 months experience or just fresh out of school, is really letting them have a say at the table. Doesn't mean you have to agree with them, but letting them feel they're part of the team, and they might add something, a different look at the problem than the way we're looking at it, because they got a different lens, and that really works. And to really say what Jeremy said, we started an AAR like 2 months ago, and it's an after action report, and we do it in the military all the time. And we went through every worker and commissioner for that reason, to see what we did good, what wasn't good, what we can change for the next scenario, but also writing a lot more desktop SOPs. So when people leave, and to say what some of the people said, this, people are going to move on. They're going to go to the private sector, or they're going to go on to different things in their life. So when the next person comes in, there's a foundation for them to get their experience from, because if you want to build a strong house, you need a strong foundation. And it just, when that person comes in, they have something to read off of, they have something to learn off of, and continuing to train off this crisis. We always talked at the end of every day to say, all right, what went well, what didn't go well, what could we have done better? And doing all that will make us stronger going into the future to handle, hopefully when we get out of this, handle the next crisis that we'll be faced with.
Thank you so much. So, I cannot thank you enough to everybody who attended the webinar today, and a special thanks to our 4 panelists, County Executive, Barbara, Jeremy, and Madre, for sharing not only your stories, but also your insights on managing in the public sector during this time of pandemic and what opportunities lie ahead. I hope you enjoyed the conversation as much as I did. A recording of the webinar will be available on our website at www.rockinst.org. I encourage everyone to check out our latest research and learn more about the Rockefeller Institute and what we do by visiting our website. One final thank you again to the panelists, as well as everyone involved behind the scenes at our team here at Rockefeller, who helped organize and get this webinar up and running, and hopefully set the stage for future conversations. Take care and be well.